Hello, Psych 101 students. Welcome to Module 7, Chapter 14, Learning Objective 4. We will look at schizophrenia, causes of schizophrenia, and personality disorders. So, schizophrenia, or phrenia, is a psychological disorder characterized by extreme alterations in thought, in perceptions, and or in consciousness, resulting in a break from reality. So the person experiences psychosis. Around 1 in 200 persons around the globe have schizophrenia. So it's less than 1% of the population, but schizophrenics make up over half of the people in mental institutions. The rates for men and women are similar. Schizophrenia is characterized by a combination of motor, cognitive, behavioral, and perceptual abnormalities. These abnormalities result in impaired social, personal, or vocational functioning, or in some combination of these impairments. To be diagnosed with schizophrenia, a person has to have shown continuous signs of disturbances for at least 6 months. There are five major DSM-5 symptoms for schizophrenia listed here. We will go over these shortly. Delusions, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. A diagnosis of schizophrenia requires a person to show 2 or more out of these 5 symptoms, including at least one of the first 3 that are listed here. This picture shows an example from the movie A Beautiful Mind back in 2001, where Russell Crowe played the real life Princeton mathematics professor and Nobel laureate John Forbes Nash. So it's based on a true story, certainly. He fought his schizophrenia by intellectually rejecting his delusional thinking. John Nash ended up dying in 2015, but it's a very good movie and gives you a kind of a glimpse into schizophrenia. And if you want to take a look at it, researchers tend to group the 5 symptoms of schizophrenia into 2 categories. Positive symptoms are symptoms that are marked by excesses in functioning, such as delusions, hallucinations, and disorganized speech or behavior. So they're positive symptoms because something has been added to the person's normal behavior that wasn't there before. So they now have delusions and they didn't used to, or they have hallucinations and they never used to, and or disorganized speech or behavior that never used to be there. So they're excesses in functioning, meaning once again something has been added to what was their normal behavior. With a negative symptom, these are marked by deficits in functioning, such as apathy, lack of emotion, and slowed speech and movement. So something is missing from their normal behavior. So apathy is the missing motivation, lack of emotion, they're missing emotions. Slowed speech is, they're missing their normal speech rate, or they might be moving less than they used to. So it's like something has been taken away. So positive symptoms, something added; negative symptoms, something missing from normal behavior. People with schizophrenia tend to be less impaired when their symptoms are predominantly positive rather than negative. And at first it may not seem that way. You may think, oh, things like delusions and hallucinations sound, more bizarre than apathy or lack of emotion, but we're better at treating the positive symptoms. We have drugs that can help with the positive symptoms, but we're not as efficient at treating negative symptoms, and it's somebody with negative symptoms. It just indicates a more advanced level of schizophrenia. Um, okay, let's go over the positive symptoms of schizophrenia, and we'll start with delusions. These are strongly held, fixed beliefs with no basis in reality. That is, they're false beliefs, and you believe something that is, certainly not true. Um, okay, I'm just going to go on. So, yeah, you believe in something this that's not real or not true, and it's and it's obviously not true or real to somebody without schizophrenia. It's just to a normal thinking person. But the thing is, you can't convince somebody with schizophrenia that their beliefs are false. They will, no matter what kind of evidence you try to provide, or however you try to approach it, they will they will find ways to hold on to their delusions. Um, Hallucinations are sensory perceptions in the absence of external stimuli. Uh, so you're seeing something that's not there, or you're hearing something that's not there. Auditory hallucinations tend to be the most common, and this makes sense because we all kind of have a voice in our head, anyways. We when we talk to ourselves in our head, uh, I know I do. I think most people do, and so sometimes with a schizophrenic, they will believe they're hearing things that are actually coming from their own thoughts. Like it's their voice in their head, and yet they believe that they're hearing it coming from somewhere else. And there's other reasons why auditory ones are more common. Like you could be hearing certain sounds that you just imagine are voices and things like that. Um, Visual hallucinations tend to be more rare, seeing something that's not there, but certainly they certainly do exist. You could also have olfactory hallucinations, smelling something that's not there, or bodily hallucinations, like you're feeling like pressure against your skin that's not really there. For instance, here's some common delusions and false beliefs associated with schizophrenia. This is a chart from page 570. Um, so persecution, you believe that people are spying on you or trying to harm you. Or, there are people that are against you or after you that are doing things to harm you. My sister has schizophrenia, and her thoughts are full of persecution, delusions. Um, I when I the times I do talk to her, I don't talk to her as much as I used to, because it's agonizing. But it's just I hear all these outlandish stories of um, of her being hit. All that she calls it being hit. She's constantly people doing things against her. Um, Anyways, referential is belief that objects, events, or other people have particular significance to you. As the example here is maybe a stop sign has a particular personal message for you. Grandiose or delusions of grandeur, they're sometimes called. You have great power, knowledge, or talent. Like I am the best at this, or I'm the, like it's like you're somehow really significant. Um, and Okay, identity is a belief that you're someone else, such as Jesus Christ or the President of the United States, or guilt is belief that you committed a terrible sin, and delusions of control or that your thoughts and behaviors are being controlled by external forces. Um, okay, let's go on here. Two more positive symptoms are disorganized speech and behavior. With disorganized speech, it's speaking in an incoherent way that involves frequently changing topics and saying strange or inappropriate things. A couple of specific types are listed. loosening of associations is a person skipping from topic to topic. This is something my sister does constantly, and which is why it's so hard sometimes to have a phone conversation with her. She lives up in Canada, and I don't see her often, but when if I talk to her on the phone, she will talk without interruption for an hour or more if I let her. If I and it's I can't even get a word in. She like this. It's such an abnormal kind of conversation. It's just fast speech for she'll fill an hour with no problem. And it goes from, it's not one main topic. It goes from one topic to another topic to another topic to another topic. And so like sometimes my wife will ask me like what you talk about, and it's like I can't. Sometimes I can't. I don't even know. Like it's just Interpol and identity theft and this person that's after and this and it goes from one thing to another and and the person like can just keep going and without they don't look for normal feedback. I seriously don't have to say a word, and I try to every now and then she might say, are you still there?" And I just have to grunt or something. Uh, but there won't be a single question thrown my way. There won't be like it's completely one sided topic, one sided conversation, and it just goes through so many different topics, and it's just the connections from one topic to another are so loose. This is what loosening of associations is. Um, she doesn't really do clang associations, but that's another type where they string together words that rhyme. Um, okay, just disorganized behavior um, is acting in strange or unusual ways, including strange movements of limbs and inappropriate self-care, such as failing to dress properly or bathe. Disorganized behavior may include unpredictable or inappropriate emotional responses, such as smiling, laughing, or talking to oneself. Um, if you schizophrenics do tend to um, congregate more in cities and in downtown areas because there's often some support services that they might be able to use or um, but it's not unusual. If you could certainly see some people in Rochester, like you can often identify somebody when they're walking along just mumbling like to themselves. They're not with anyone, and then all of a sudden they might just laugh. Suddenly they're mumbling, and then they go ha, and then they keep mumbling. It's like, and it's just you can kind of see like once you get used to the behavior, you can kind of pick out um, schizophrenics sometimes with this talking to themselves and the sudden emotional responses like laughing and smiling and um, there may also be motor disturbances such as rigidity, which is staying very still. In extreme cases, a person might stay still for hours, or like, where they're just in one position and they're just not moving at all. And you can actually move their limbs around like a doll. Like you put their arm, up, and it'll just stay there. And so that's extreme cases. But rigidity is just very little movement, and it can go the other extreme to wild, purposeless movement. It'd be like a person just running around in circles, almost like they're like doing a lot of movement, but they're not really accomplishing anything. There's no goal in mind. They're just moving very quickly and almost. It reminds me when you see that kind of behavior. It reminds me like a preschooler just kind of running around for that because it's fun. But okay, let's go on here. And this brings us to negative symptoms. I'm just going to go over what's on here. I don't have too much to add. So, about 1 in 4 people with schizophrenia show reductions in typical behavior, which are called negative symptoms. Here's a bunch of examples. People with schizophrenia often avoid eye contact and seem apathetic. They may not express emotion. Their speech may be slowed. They may use a monotonous tone of voice. They may take long pauses before answering. They may fail to respond to a question or be unable to complete their sentences. Negative symptoms are more common in men than in women. Schizophrenia. Okay, so once again, there's something missing in each of these examples. It's like, something is slowed down or is missing from their normal behavior. Schizophrenia is caused by biological and environmental factors. By the biological perspective is that schizophrenia is caused by genetics, chemical influences, and brain structural defects. So twin and family studies show that there is a significant genetic element to schizophrenia, and we'll see evidence of this on the next slide. There's also evidence of neurotransmitter differences, especially in dopamine levels or dopamine receptors in the brain. Schizophrenia is most often diagnosed when people are in their 20s or 30s. My sister got it in her early 20s, as when it was first really noticed as a problem. So in this graph here, you can see that a person is more likely to develop schizophrenia the more closely related they are to somebody that has it. And this is, certainly evidence of the genetic, of that it's at least partially genetically has a genetic basis. So you can see identical twins. Like if one identical twin has schizophrenia, it's 45% chance, almost 50% chance that the other one will also develop it. Because remember, genetics share 100% of their genes. Once again, because it's not 100%, like we know that environment comes into play as well. But, considering that, if you look at the very bottom part of the graph, an unrelated person, this is like just kind of the general rate, like, is around, it's around 1 to 2% of the population. So 45% though for identical twins, I mean, that shows certainly that genetics are at play. Same as the next one. If both parents have schizophrenia, is about a 45% chance that the child will have schizophrenia as well. And then you can see other relations. Fraternal twins, the offspring of one parent. So if just one of your parents has it, these are all around 10% or so. Siblings, which is my case. So I have, I had a 10% chance of having it. I will tell you that I've certainly experienced some schizophrenic symptoms during my life that have been brought on by certain experiences I've had in my life, and so I have had some experiences of feeling, getting a glimpse of what it's like, where I don't want to get into all the specifics, but I had delusions that lasted, for a weekend at a time, where I totally believe in some crazy things, and anyways, it was brought on by circumstances that I learned about as I learned more about this, and I learned what could bring on symptoms for me, and it's always been a concern that I would get stuck there, and I because it's a horrible way of thinking, when you constantly believe in things that are not true. And I'll tell you, I mean, there was a 2 to 3 day period where I actually believed I was dead. It's hard to explain, but I was. Anyways, but I was. It was a real belief. Anyways, let me go on. But so you can believe really crazy things when you're in a schizophrenic state of mind, and so I very much pity people that have it, and it must be terrible to live with. Okay, going on here. So, if you look at this picture on the right here, these MRIs are from twins. One that has schizophrenia on the left, and one without. The one without is on the left, and the one with schizophrenia is on the right. And you can see that the one on the picture on the right with the twin that has schizophrenia, they show larger ventricles, which are these are fluid-filled cavities in the brain that appear as those dark images. And this suggests the fact that it's larger in the one twin versus the other. It suggests that the twin's brain may be deteriorating over time, which is, what leads to having these larger gaps. So these are fluid filled, but there's no brain tissue in these. And so if you have a larger fluid filled ventricle, it means you're missing brain area, from that part of the brain. So, anyway, both of these are pieces of evidence that, biology is certainly at play. Environmental factors also affect the development of schizophrenia. Remember the diathesis stress model? It proposes that schizophrenia is a joint product of a genetic vulnerability, which remember we call the diathesis, and environmental stressors that trigger that vulnerability. It triggers the diathesis. And this would support the finding that more people get schizophrenia in urban environments compared to rural environments because there are more stressors in an urban environment. So the stress is one of the components that is needed according to the diathesis stress model. And we can see kind of in picture form here. So one example of an environmental stressor is being raised in a dysfunctional family. So if we look at this picture here, this person on the left, in the left picture, has a genetic risk. So they happen to have some genes that give them a risk for schizophrenia. And then if they also grow up in a dysfunctional family environment, and I will say that my family was somewhat dysfunctional, and which may have brought on my sister's schizophrenia. But anyways, this person would have a high risk of developing schizophrenia. The same person, though, that has the bad genetics, if they grow up in a healthy, loving family environment, they would have a low risk of developing schizophrenia. So you need nature and nurture. So you've got some genetics that give you the risk, the diathesis, and then you also need stressors in life that trigger that vulnerability. And so this person on the, in the right picture, this person doesn't have a genetic risk. So whether or not they grew up in a stressful environment doesn't really matter. They will still have a low risk because they don't have the initial genetic risk, the initial diathesis. So keep in mind, this is nature plus nurture. You have something in your genes and you have life stressors, and the combination is what can cause the schizophrenia. Okay, that's it for schizophrenia. Now we're going to look at personality disorders. The personality disorder is a type of mental disorder in which you have a rigid and unhealthy pattern of thinking, functioning, and behaving. A person with a personality disorder has trouble perceiving and relating to situations and people. When this style of interaction is long-lasting and causes problems in work and social situations, it becomes a personality disorder. The DSM-5 divides personality disorders into three main groups. You can see them in this chart here from page 575. The first group, or what they call cluster, is those personality disorders characterized by odd or eccentric behavior. This includes paranoid personality disorders, schizoid, and schizotypal. You can read the descriptions on your own. Cluster B is characterized by dramatic, emotional, or erratic behavior. It includes antisocial personality disorder, borderline personality disorder, histrionic, and also narcissistic personality disorder. And then we have cluster C, which is characterized by anxious or fearful behavior. It includes avoidant, dependent, and obsessive compulsive personality disorders. Now, we already talked about OCD, obsessive compulsive disorder. This is somewhat different. Okay, so personality disorder is not the same thing as a major disorder. So like obsessive compulsive disorder, remember it was people had obsessions about specific issues, like for instance being worried about germs and disease, and then this would cause them to perform compulsions. And the person with an obsessive compulsive disorder, they were fine before they developed the disorder. They were, they lived, you know, their life very normally for a long time, and then they developed the disorder. And if they were to treat it and get past it, they'd be normal again. But personality disorder is different. It is. You can see signs of it, all the way from childhood and adolescence into adulthood. I mean, it's long standing. It's not like something all of a sudden developed that made the person different. It's like they've always kind of had a history of being a certain way. Now, with the obsessive compulsive personality disorder, uh, you don't really get the same kinds of obsessions. People with obsessive compulsive personality disorder, they tend to really be focused on orderliness and perfectionism and detail, and they're often not self-aware of, these issues. Um, if you have OCD, the disorder, you know you've got the disorder, like that you've got a problem because you're a performer, but you just can't help yourself. You get the obsessions, you can't help it. You do the compulsions because you really need to. You can't help it, but it's a problem. Like Howie Mandel wrote a book. Somebody with the personality disorder is just kind of who they turned out to be in a sense. Like it would be somebody that like they always have to have things arranged in a certain way in their house. They have certain ways that things have to be done. You always have to scrub this pot 3 times at least. And it's like it's not like necessarily compulsion. It's just they've always believed there's certain ways to arrange things, and they would tend to somebody with the disorder would tend to have all their CDs alphabetized, and the bookshelves might be alphabetized. Like they want things orderly, and occasionally numbers come into play. I was with um, I knew this woman once, and I stayed at her place for a number of days when I needed a place to stay, and we worked together. And she had threes all around her apartment. Like there was collections of. There was always like three things. It'd be like if there was like plants, it'd be three plants, and if there were pictures on walls, would be in groups of three, and there was this line of these little figurines all along this long windowsill, and I didn't have to count them, and I didn't. Like I knew there's exactly 27, which is three cubed, three times three times three. Like, and because I'm kind of a number person myself, I have some strange number things that go on, and anyways, but I mean, I really kind of identified. I noticed right away the numbers with all the threes, and I knew that there's 27. I kind of asked her about it, and like she got really angry and didn't want to talk about it all. And but she this is just probably kind of is how she's always been, and that's the thing with the disorder. Oh, sorry, with the personality disorder, you can stretch it back. You can see like signs of it. Oh, remember they were like this in childhood, and they were strange in this way, and in adolescence they were strange in this way. So it's more rigid. It's not like you all of a sudden developed a new disorder that can be fixed. Personality disorders are hard to treat because the person is just kind of the person's been living that way for a lot of years, and like I said, they're usually not self aware that they're problematic. I just like cleanliness, or I just like orderliness, and it often kind of focuses around things like that and attention to details. And anyways, so I just want to use that one as an example that these things can can um, seem similar to some disorders, but when it's a personality disorder, it's usually developed in childhood, and is just kind of and it's who the person's become. It's part of that's why it's called a personality disorder. It's part of their personality, and that's why it's so hard to change. Okay. Um, let's go on here. Okay. So I'm just looking at some notes here. Okay. We're just going to look at a couple of them here. Borderline personality disorder is personality disorder characterized by disturbances in identity, in moods, and in impulse control. Also, self-destructive tendencies are often present. So, for instance, like self-cutting behavior is some somewhat common among people with borderline personality disorder. Um, it only affects 1 to 2% of adults uh, that meet the criteria for BPD. Mainly women are affected by this. Borderline personality disorder may have an environmental component because of the strong relationship that exists between the disorder and trauma or abuse. So there is often some kind of um, triggering events, particularly once again if it's during childhood, somebody that's um, experienced trauma or abuse during childhood may end up with borderline personality disorder. And we have antisocial personality disorder. This is a personality disorder marked by disregard for and violation of the rights of others and by lack of remorse. Those with antisocial personality disorder tend to lie, break laws, act impulsively, and they lack regard for their own safety or for the safety of others. They often show complete lack of empathy or remorse when they harm others. Um, Psychopaths are considered to have a severe form of antisocial personality disorder. And by the way, people sometimes ask in class, like, what's the difference between psychopath or sociopath or antisocial personality disorder? All basically the same thing. There might be some, an expert could point out maybe some technical difficulty between um, one or the other, but they're really the same thing. They're just different names. Well, so when you hear somebody's a psychopath, or you hear they're a sociopath, or you hear antisocial personality disorder, which is the real um, the medical the real psychological term for this, they all refer to the same thing. Okay, so but as I said, psychopaths they're people with extreme antisocial personality disorder. Same thing with the sociopath; they have an extreme case of this. Ironically, people with psychopathic traits are often seen as charming and intelligent. Uh, Psychopathy can be considered a personality trait. It revolves around the general lack of caring for the welfare of others. And along with narcissism and Machiavellianism, it's part of the dark triad that came up in an earlier module. Um, okay, let's go on here. Um, Ted Bundy, pictured here, is considered a prototypical example of somebody with um, who is considered a psychopath with antisocial personality disorder. So that would be his diagnosis, in the present day. Um, In the United States, about 1 to 4% of the population has antisocial personality disorder. But once again, they're not all psychopaths. So only the extreme cases are actually going to go and kill people and do things like that. But there are a lot, 1 to 4%. There's a lot of people walking around with this personality disorder that, where they really, their whole thoughts are just for themselves, and they don't really, they will scam people if it improves their lives, because they don't really worry about hurting others. People with APD are primarily males. About 20, they say about 25% of the prison population would qualify as having antisocial personality disorder. Because once again, if you have this, you're more likely to do things like break laws and commit crimes, because you don't really tend to worry about your own safety, and so you don't really worry about ripping people off or hurting others, and so it's like it's really it really leads to people taking more risks, and they're more impulsive, and they'll just, oh, I need something, I'll go steal it, if I don't have the money. um, Let me go on. Okay, various physiological abnormalities may play a role in this disorder, including brain regions that are involved in responding to fear and impulse control. So they've shown in studies that people with antisocial personality disorder, they don't respond to fearful things the same way as a normal person, um, and if they could watch, a movie that would cause fear in most people, and they tend not to experience that same fear level. For instance, so with the lack of fear, this is what makes them, more likely to take risks. So then, because they don't fear being caught, or they don't fear that they might get harmed, and once again, it also affects the brain regions, also affect impulse control. So they will just, they won't think things through, and they'll just act. Um, okay. Anyways, this will conclude learning objective 4.